Very good evening, friends. Meeting again in the session of philosophy, and we have started discussing about the last chapter from the fourth year syllabus and the last chapter of H.A.Robert's philosophy, that is modern medication and the homeopathic principle. In the introductory part, he has discussed something related with the modern medicine and its modern medicines and their applicability. There is nothing specific, there is no specific principle on the basis of which those drugs are prescribed, and all drugs which are used over there have only one purpose, that is to palliate the things. Generally, whole allopathic system is related with the or concerned with the pain and how to relieve the pain. What is the cause behind the pain? What may be the reasons behind the disorders? That has been not taken into consideration, and because of which there is only a palliative results which we used to see in chronic disorders. It never cures the patient over there, and people becomes habitual to the drugs. What hazardous effects those drugs produces, no one knows, and people are addicted to the medicines. We have there that the in at the medical store, in the counter, they receive whatever the medicines the patient requires. Everything patient asks, and the medical store, the man, the pharmacist used to give the medicines without a medical practitioner's prescription. And this is the problem in India, because of which lot of people are addicted to the many drugs. And those drugs are only serve one purpose, that is called as palliation. So we are there on the page number 279. Last paragraph will start with it. Such an agent was aspirin, first advanced for its harmless sedative properties in the control of pain. It was widely used and in considerable amounts by the physician and layman alike until its depressant properties came to be respected by the careful therapeutists. The American Medical Association found it advisable to publish warnings against the use of this substance, which was commonly sold under the trade name of aspirin. But the use of substance was not curtailed to any marked degree except by the most careful prescribers. It had become a cure-all for domestic use and all too often in hospitals and by physicians who sought first the suppression of distressing symptoms rather than the cure of the patient. When aspirin was discovered and used in the practice, then everyone was so happy because it was controlling the pain within few minutes, eh, without knowing what it will going to cause in the human life. It was very widely used drug to start with. It was used by registered medical practitioners. It was used by the specialist orthopedician. It was used by the physicians. It was used by the chemists, and it was it was marketed like that. It is a painkiller, strongest painkiller. And later on, they started finding it out what danger it can cause. The first danger it has caused is gastritis. Second danger it has caused that hematemesis. Third danger it has caused that it used to do a platelet disintegration. All those things they were found later. So such a thing is there with all those molecules which they used to use in their pathy. Homeopathic physicians have long known the dangers of suppressive measures and have always had due respect for the innate powers of any medicament. It was Hahnemann who observed that any drug was poisonous if dangerous doses were taken. And this is truth. Anything which is taken in maximum quantity always produces harm for the human being. And this is the problem. The larger doses which they used to use in modern science used to produce many hazardous effects. See the pediatric practices, and if the the child is having little bit septicemic condition or little bit fever, high grade fever, they used to use higher antibiotics in a very massive doses, bolus doses, without considering what it will going to cause. It might cause bone marrow suppression, producing later pathologies, and those pathologies were labeled as separate pathologies, never considered that it was the effect of that bolus dose of the antibiotics. Such a thing which is very common in allopathy. The ability of the trained homeopath to observe and correlate symptoms made it foregone conclusion that he would easily trace the depressed vitality, the heart attacks, and many collapsed conditions to, to the frequent use of aspirin and like painkillers. And when the patient returns to us, we have to be very careful. We must take into consideration what are the medicines used prior to it. Just 15 days back, I had a young lady doctor who came to me for nephrotic syndrome. I think I shared that case with you. And why she had that? Because of the lot of ointments used on the face, which contains mercury. And her um, protein output was too high. And that's why she developed a tremendous edema over the lower extremities, diagnosed as a case of nephrotic syndrome, but no one considers that it is because of the local ointments. Then I started her medicine, and yesterday she came for follow-up after 15 days, and her all levels had reduced 50%. Her whole edema disappeared under the homeopathic medication. But I have asked her that to stop every ointment, no cosmetics, nothing. And then she came home. These are the effects of local ointments. How much danger is the internal medicine, taking the internal medicines in larger doses. The homeopathic physician is likewise trained to realize the dangers of suppressed and masked symptoms. That pain has its beneficent aspect as a guidepost, and that the discomforts of an acute cold or grippe cannot be suppressed without grave danger of the ultimate health of the patient. The prevalence of the symptoms never been well since is the proof of it. This is the sentence which comes in Materia Medica, never been well since. Patient comes to you, I had malaria and I was admitted and I was there for 15 days in the hospital and I was treated with so much of medication. And till that, since then, I'm not at all recovered. Fever has gone, but I'm not recovered. Never well since malaria, never well since typhoid, never well since a specific disorder. This is quite common. And if it is there, then always look for what medication patient has consumed. If patient has consumed a lot of medication, it is always better to antidote that with the help of your very well-known common remedy, that is the Nux vomica. Nux vomica works wonderfully. Nux vomica brings those patients out very easily, the hazardous effects of the medicine. But this one must know the phenols and especially phenobarbital were hailed loudly as curative and especially palliative of many ills. It was not long before that their deadly nature was discovered and the warnings were posted against their use. They are still used extensively but much more conservatively than formerly. In many of these instances, it is early dangerous action that is discovered, and the latter, more insidious and long lasting effects, are undiscovered or ignored until too late. These become constitutional and therefore are unrecognized. So he has given one more example of a phenobarbital. Phenobarbital was very strongly prescribed in epileptic cases. Cardinal was the common name. And people were taking those. They becomes addicted to that. Later on, it was compelled by the government that this medicine should not be prescribed or given to any patient without a registered medical practitioner's prescription. And thereafter, there was control. And now those drugs are under control of Drug Act. And because of which the control had happened. because people gets addicted to such types of medicines. There are many medicines to which patients are addicted. There was a 1 cup remedy, antitussive, the codeine, linctus codeine. It was containing codeine, the drug, and the people get habituated to that drug, and because of which, not for the cup, they are consuming it as a drug addict. See the dangerous effects it used to produce. In the last stage of the cancerous cases, what do they prescribe is the generally all those opium derivatives. And patient gets so addicted to such tablets that they want off and on. Such a dangerous effects can happen because it used to produce their deadly effect on the human mind, human sensory. Of course, all these effects from first to last are homeopathic proof of the potentialities of the cure that lie in this synthetic drug. To the homeopath, however, there should be but one criteria for their use: the similarity of symptoms produced in the healthy for application into like ills in the sick. There were some people who have tried without proving the remedies, allopathic remedies in human being. Some have tried to triturate those drugs and give it to the patient for the same purpose. Robert wants over there, this is called as isopathy. This is not homeopathy. Unless you prove that drugs on healthy human beings, find it out, a totality, what it used to produce, and apply it on law of similars, it never becomes homeopathy. With thinking, if you are using it, it is illogical. It is not logical and it will not going to work. So if you want to use all those synthetic drugs in your practice, you can, but first prove them properly. Find it out what symptoms it used to produce on provers, and then apply on the basis of symptom similarity, not as a palliative. So this is very important thing which is explained. The popular sulfonilamides are one of the best instances of the powers and dangers of synthetic drugs. They have been held for their powerful action in infections of many. One is tempted to say all kinds. It is true that in laboratory and clinic they have proven this power, but along with proven power of destroying invading organisms, they have like danger to normal cell balance. This has been recognized by those who developed the drug to the point where careful therapists will not use these agents without keeping careful laboratory check on the bloodstream and other functions of the patient. The most problematic area is the laboratories where these drugs are checked. The checking is done in test tube. And when checking is done in the test tube, and when they use such types of antibiotics on the antigens, and they see that it kills the antigen so strongly, they never takes into consideration that in test tube it is quite easy. In the live healthy human being, when you use same medicine, the human being is not test tube. There are a number of cells present, there are a number of secretions are present, there are a number of chemical mediators are present, there are a number of hormones are present. So in that specific condition, if you try to use the same medicine and consider that it will kill that bacteria, how can it be? Yes, it might, but at the same time, it might kill the cells, normal cells. And this is the dangerous effect or very hazardous effect used to produce on human body when you use the same medicine which was tested in laboratory and when you use it in human being. And that's why this has happened, that Cepran, which was number one medicine, which was containing sulfanilamide, along with the trimethoprim and sulfamethoxazole, which was used very strongly by the people, general practitioners, everyone was using Cetran. Later on, they find that People have developed Steven Johnson syndrome. People have developed all rashes all over the body. And it was the hazardous effect, which was constitutional effect have seen in many patients because of the symptom. So those drugs are not so fine, or they are not the drugs which will harmless. They are absolutely harmful for the human being, and they disturb the balance of the human body, at the same time the human cells. Probably more variations of this group of drugs have been developed than of any other that has become popular. When sulfanilamide was first publicly recognized and marketed, it was permitted to fall into the hands of the laymen who had read glowing accounts of its value and who decided that they could cure themselves of all their ailments with this wonderful panacea. Number of these hopeful sufferers purchased and many deaths resulted. Manufacturers of the products were obliged to keep a closer watch on the production and distribution, and research chemists set about developing less dangerous combinations. The fact remains that where medicinal agents are capable of eradicating organism by any other method than by stimulation of dynamic force to the point where nature itself balances scale, there is danger to the patient sooner or later. Very important thing which he has explained. Sulfanilamide is the derivative from which many other combinations or many other drugs, further molecules have been developed. And all those were used rampantly. Then people started understanding, oh, this is wonderful remedy. They started using such drugs by themselves. And without medical practitioners' note, they start purchasing them and using them themselves. Many deaths have happened. And then people understood that those drugs in test tube, even though they are found to be very useful, they are hazardous to the human health. And thereafter, it was publicly, or it was very specifically labeled that unless and until it is prescribed by medical practitioner, one should not give this medicine to the layman. So see, such things have happened in the lab. And all drugs which are used over there used to produce their dangerous effect. And one sentence which he has explained over there in this paragraph, that if the medicine is given and which stimulates natural immune reaction, and if that natural immunity, that natural antibodies fight against the antigen and kills that antigen, it is the most safest method of treating the patient. Instead of using antibodies externally purchased from outside, used in human being and affect the whole human health instead of just killing the antigens. And this is what happens when you used to use such heavy drugs or larger doses of the drug. It is no doubt it is no doubt true that sulfanilamide and its variations have a comparatively good record in such conditions as pneumonia and like infections. That is a good record compared to that of dominant school, where pneumonia is a dangerous and often fatal disease. The sulfonamides have so far given a more creditable record than the serum treatments of pneumonia, which were so well sung only a few years ago. And in the use of sulfonamides, only prompt use is necessary. One may omit the typing and thus save the time. In fact, it has been said by eminent authorities on the use of sulfonamides that in infections they must be used promptly in the onset of infection of whatever kind, and or they are useless. So sulfonamide was very famous at that time. Even today also sulfonamide is used by people, old practitioners. It was one of the important remedy in order to kill the patient, kill the bacteria of the patient, not the kill the patient, but bacteria. But at the same time, when it used to kill the bacteria, many times it has killed the normal cells. And when it has killed the normal cells, many times dangerous constitutional disorders have developed in the people. Many people suffered from the deaths. Mortality was very high, even though it has cured many pneumonias. That's what he's saying. Pneumonias, then many infections have been cured by it, no doubt. But at the same time, it has caused multiple harms to the patient. So every medicine which was there in allopathic system of medicine have dangerous effects on the human body. I think it's better to stop over here, and we'll continue with the same chapter tomorrow. Mostly in within 2 or 3 lectures, we're going to finish this chapter and we'll learn what such a modern medication can produce, how harmful it is and how useful it is. Both aspects Robert is trying to explain over there. And he, at the end, he's comparing that with the homeopathic principles. So that's all for today. Thank you being there. Good evening to everybody.
Thank you and good evening, sir.
Thank you, sir. Have a good evening.
Thank you.